Your pet has cancer. They're terrifying words for anyone to hear.
Well, your heart falls into your stomach and you panic, and then you say, okay, what do I need to do? And let's do it immediately.
We thought it was a death sentence at first. It's cancer. It's a dog, it's cancer. What can they do?
Very often, especially when the diagnosis is lymphoma, the answer is another terrifying word: chemotherapy.
Then you worry about quality of life. That was our next concern. I'm not going to put her through what my relatives have gone through, where she's miserable for a year and then passes away inevitably anyways.
Although I wanted every day with her that I could get, I didn't want it if she was going to be suffering at all.
Unfortunately, most people know somebody or have a close association with someone that has gone through chemotherapy. And for humans, it's a much different experience than it is for dogs and cats.
And that is the key message the oncologists at Oakland Veterinary Referral Services want pet parents to get.
It is different in dogs and cats, and we use the same chemotherapy drugs that people receive, but the doses that they receive are much lower, and the frequency in which they get chemotherapy is not nearly as intense.
Oh, she likes it. Oh, Carl!
They don't usually lose their hair, but she lost the hair on the top of her head and around the sides of her nose. So she had this very teeny little funny pointy head with this huge fluffy body. She looked like some kind of an animal out of a movie. She was terrific the whole time.
With dogs and cats, usually if you do get any side effects from the chemotherapy, they happen between 2 to 5 days after the treatment. In most cases, those side effects are fairly minimal and self-limiting, meaning that you might have a day or two where they're not eating as normally as they would otherwise, or you might have 1 or 2 episodes of vomiting or diarrhea. Those usually resolve with a bland diet or some medications at home within a day or 2.
In fact, for many pets, there are no negative side effects, but quite a few positive ones.
Oh, come on. There's my love. There you are, little superstar.
Enoch's process, very surprising in that he responded to it immediately, perfectly, happily, joyfully. No bad side effects, except for maybe a little bit sleepy.
The lymph nodes were starting to go down right away. That's the size of her lymph nodes. And then she started getting some energy back. We have other dogs that she had stopped playing with, and she started playing with them more, getting more interested in doing things again.
For the oncologists at OVRS, good quality of life is the chief aim, especially for dogs like Jocelyn and Roxy, who were diagnosed with one of the most common cancers in dogs, lymphoma.
As a doctor, I don't tolerate making them feel sick all of the time with the goal of just treating cancer. We're treating a whole patient, and we're really treating a whole family. And so that's what's important. And so what we do is we dose the chemotherapy to be effective against the disease and to provide disease control, but not push them to the point where they're feeling sick a majority of the time.
Our goal with most of our patients is actually to maintain their quality of life while they're receiving chemotherapy, but also improving their survival time overall.
To accomplish that, OVRS doctors use the same chemotherapy drugs humans get, taking great pains to use the most effective drug cocktail for each pet they treat.
The one that we recommend most is called the CHOP, or the University of Wisconsin protocol, and it uses many different kinds of chemotherapy drugs that work differently, and so they attack the cancer cells in different ways. And by using a multi-drug protocol, we can usually achieve better remission rates and longer survival times.
Many pets, like Jocelyn, also use complementary or alternative therapies. OVRS is the only specialty center in Michigan offering them.
Acupuncture is very helpful in potentially helping with energy levels. In people, they use it a lot for treatment of nausea and diarrhea issues when they're going through chemotherapy.
While lymphoma does not have an official cure, it is highly treatable.
I've had some dogs with lymphoma that have lived long enough to pass away from something completely different than their cancer.
And the results of chemotherapy have gone well beyond the expectations of so many pet parents.
He's 100% in remission. He went into immediate remission I think it was the day after he received his first chemotherapy treatment, the lump went away. It was gone. Tears of joy.
We have her back.
Oh, we definitely have her
We've
back.
had her back for a while. She went off chemo probably about 3 months ago, and she's been doing really well. And with the spring coming around, she has just as much energy as she used to have, which is good. Just as spry, playing with the dogs. It's wonderful.
Look at how beautiful she is. Isn't she beautiful? What the doctors tell you they can give you, which is, you know, probably about a year to a year and a half extra, or 6 months extra, is the average. It could be much longer than that. Roxy's cured. After 5 years, they consider the dogs and people cured. So, you know, it was certainly worth it.
Giving pets and their humans the gift of not only more time together, but more quality time to enjoy each other.
Hi. Hi. Come here. Focus. Mwah.